The RHIC Simulation Center is located on the campus of Union Hospital Terre Haute, which is located in Terre Haute, Indiana, which is on the border of the western border of Indiana with Illinois. And we are located in two separate buildings on the campus. One is in Union Hospital's West Building, which is where our acute care wing is, and then across the street in the Lansbaum Center for Health Education, and that's where our primary care clinic is located. In 2009, the east building of the hospital was built, this is the front part of the east building here, and at that point the ICU was vacated, and that's where the acute care wing is located. This is the inside of the atrium. Wanted to give you a shot of that since you're not going to be on campus, and then we'll go back outside here so we can kind of walk around the building a little bit. Just want to give you a feel for what the campus looks like, and then we'll end up going inside the Lansbaum and inside the hospital in a second. Across the street from the hospital right here, this is the professional office building. This is where a lot of the medical offices for the health system. And additionally, the Center for Education is located over there, and this fitness center. So this is the east building. As we go across, this is the west building, the older part of the hospital, and the second floor of that building you can see is where the simulation center is located. The third floor is the pediatric unit, and outpatient telemetry is located over there as well. I wanted to give you this shot because this is the typical entrance for most students who come into the simulation center through the west building. And then right across there you can see kind of underneath that awning is the Lansbaum Center for Health Education. Alright, so we're a little bit of ways away, about a block away from where we're at before, and I wanted to give you kind of a framework of what we're talking about. This right here is the Lansbaum Center, and right next to that here is our mobile simulation unit. We actually had it on campus that day because we were doing some training, so got an opportunity to show that to you as well. We use that for a variety of things, mass casualty exercises, and taking it on road trips when we go to the small rural hospitals that we visit quite often. The Lansbaum Center was built in 2001, and it has a lot of classroom space in it, conference rooms, debriefing rooms. Like I said, our primary care clinic is located in there as well. We took over that clinic space in 2017 and added it to our opportunities for students. The Lansbaum Center is very, very nice. It has a reception area, an atrium, and a very large auditorium, which I'll show you here in a second. So to the left here is the auditorium, and then to the right is a conference room that holds about 10 people, and then two classrooms, classroom 2 and 3. Both of these classrooms hold roughly about 45 to 50 people depending on the layout. Obviously with COVID situations right now, that's limited quite a bit. I think most of the time now we're only holding roughly 15 to 20 people depending on the event. And the classroom 3 here is basically the same setup as classroom 2. This day we were working on doing COVID vaccine training for some of the med students from the Indiana University School of Medicine. To the we'll go in is the auditorium. This, prior to the pandemic, holds 150 people. We use it for a variety of conferences, symposiums, and just everyday trainings. In fact, we We do a lot of our basic life support classes in here because we can spread people out, and the hospital system does a lot of CPR, and we offer this training once a month. And it's great because all of our BLS equipment is in that room to the front of the building, front of the auditorium there, and we can just keep it in that space. So now go through the atrium area. And to the right here is part of the clinic space. To the left, we'll go back to the clinic here in a second. And these two areas right here is another additional classroom. This one holds about 30 to 40 people. It's mostly used for the IU School of Medicine for their daily. Then across the hall is the medical library, the rural health library, and used primarily for med students, but also for lay students and some of the students that come through the primary care clinic. This room to the right here, this is one of the kitchens primarily used when we do large events for caterers to come in and use, or what have you. So we're back up to the front of the building here, and then we'll go out the first set of double doors, and to the left is the primary care clinic. It's fantastic for primary care type relations because it has all the components that you'd want in basically a physician's office. It's got a really nice lobby where we can have standardized patients waiting to be seen by the various groups that come through. We can have medical assist students sitting at the desk, or receptionists checking people in. Of course, we have cameras located all over the clinic space, so we can record what's going on in various components of the patient's throughput through the clinic. It's basically a big square, so you can go one way or the other, and it will take you all the way through the building. To the right here is one of our debriefing rooms. This holds about 10 people, pretty tightly if it's 10, but it's got a really nice system, and can also be recorded as needed. We don't typically record debriefing sessions, but when we need to, or when we need to record whatever in that room, we have the opportunity to do that. Each of the exam rooms has a computer inside and outside of it, so students can check in through the Beeline SIM capture system that we use. We use the central clinic system platform that they have for that. This room, this exam room 9, has two beds in it. This is primarily used for physical therapy type of simulations that we will do, and it's got, of course, physical therapy type beds in it. Each of the rooms has cabinetry to hold store various exam room supplies, and a sink as well. This is one of the primary exam rooms. All of the exam rooms look pretty much identical to this, with exam tables, and then each room has 2 cameras in it, and you can see we've got a cover over the top of the cameras in these rooms. Once a month there is a pediatric urology clinic that comes in here to Terre Haute, and we cover those cameras up in between use, just so we're protecting privacy for people that would come in that clinic. Most of the time, though, it's used for educational purposes. There's a mirrored nurses station on either side of the clinic, so you can simulate what you would do inside the station there. Of course, it has monitors and computers to do some of the charting that you would need to do in those situations. Printers, of course. There's a conference room or debriefing room that we can use for a variety of things, of course, meetings, debriefing, so forth. At the end of the hallway here is a clinical lab, and it's set up as a simulated laboratory. This can be used by a variety of different kinds of students, although I would say this is probably one of our underused parts of the facility. We don't use it to the full capacity that really it was built and designed for. But it has all the appropriate equipment that you would need in a laboratory. To the right here in this room is our control room for this space. And it's got 2 control areas on either side of that half wall that you can see right here. And then we can have someone located just sitting here at the desk doing the kind of making sure everything's going well with the recordings. One of our simulation technologists. We can also have faculty sitting and watching from the large screen TVs that you see there. I will say all of our space was not designed specifically for simulation, so we've had to retrofit everything, and I've had to use a lot of trial and error to make sure that it's what we wanted. This space was pretty well designed exactly how we wanted. The control room had to be retrofitted to fit our needs, but the rest of the rooms are ideal for what we would use for primary care. Some of the rooms are decorated with for pediatric type of situations, so it's got the wallpaper and pictures and stuff that kids might like. You can see the covers there of the cameras that we use for those rooms. That's the Landsbaum Center, so now we're going to go across the street to the acute care wing, which is located in the west building of the hospital. This is what we call the I-70 corridor, which is the hallway that connects the east and west buildings. It's like the I-70 that goes through Terre Haute. Alright, so we're located on the second floor of the building. And if you take a right here, you'll go into the simulation center space. We'll come back through this area. This is the driving simulator room to the left. More storage. On the right here is our skills lab. Again, we'll come back to that at the end of the tour. This is a little bit older part of the hospital. The building itself was built in the 1970s, and so it's a little different than the East building, but works very well for our purposes. When you come into the acute care wing, it looks just like and feels just like an acute care setting, because again, this used to be the ICU for the hospital. This part right here was actually the medical ICU. The acute care wing has 8 simulation suites and 2 debriefing rooms, 3 control rooms, and a classroom. And then we have office space in here, kind of intermingled. Again, retrofitted space, so we've had to deal with it not being appropriately designed for simulation, but we've made it appropriate for what is needed for simulation methodology. The nurses station is really great for a variety of things. We can do a lot of IP events where it's multiple kinds of disciplines coming in and circulating around the nurses station. And then you can go into the various rooms and do your various things. You can have basically a whole simulated nurses floor, nurses unit that a variety of students are dealing with. The room itself has all the appropriate equipment in it. All of the air, oxygen is real because it was built as an ICU, so the oxygen is real. Vacuum is there as well. Kind of gives you a bird's eye view of the nurses station here. There are 2 control rooms in this space. One on, you can see the one-way mirrored glass on the 2 control rooms on the center there. There's a couple of our crash carts here and our Broslow carts right next to them. I did go ahead and show you the inside of one of the crash carts. We do keep those locked, and the defibrillators are marked as for simulation use only. They are maintained by the hospital's biomed department, which the stickers are on the back. I didn't actually show that. I apologize. There's a crash cart code chart paper. Of course, we use all demo dose medications, no real medications, and try to keep it as organized as possible. We do a lot of ACLS classes, so these things get ransacked quite a bit, and so we're constantly having to have the instructors redo all of this. You can see the various drawers here. This is all the syringes and IV start kits and saline and so forth. Respiratory supplies there. Ambu bags, oxygen tubing and so forth. Nothing in the bottom drawer. So then we look at our Broslow carts, and if you're not familiar with Broslow carts, these are for pediatrics, and each drawer is separated out based on the size of the pediatric patient, from the neonate to the large pediatric patient, teenager. And each drawer is color coded with the specific sizes using the Broslow tape. This is the medication drawer, of course. Again, demo dose medications. That is the Broslow tape. When you stretch it out and you measure it with the size of the patient, it tells you which drawer to use specific to that. And each drawer has the appropriate sized equipment located in it. Again, these get used a lot we do a lot of pediatric advanced life support classes, and so these are constantly having to be refilled and supplies changed out. All right, so we'll kind of go into a couple of more of the simulations. This one we have set up for nursing students that are coming in from Indiana State University. They're doing some trach care and mouth care on the patient. I did want to show that although all the rooms have windows so you can see in and out into the nurses station, we do have blinds that give privacy to the students when they're doing actual simulations. And most of the time those are closed, but I wanted to have them open so you can kind of see what it looks like through the center. This room's set up for some OB simulations with our one of our Victoria models and one of our HAL models here. The great thing about being a hospital, of course, is that we get to utilize all of their equipment, and we actually have warmers to mimic what the hospital has. We have this set up for, I think they're doing some umbilical line things, like a neonatal stabilization type of simulation. Another one of the offices, I call this room the bullpen. This houses 2 of our clinical simulation specialists and our simulation coordinator, and they share that space. It's a little harder with the COVID thing. We've been trying to keep every bit more. An office space is a little bit of a challenge for us. This is one of our debriefing rooms at the center. Holds roughly 8 to 10 people. Again, COVID, we limit that more to, I think 5 is what we put in this room. Just a bulletin board with some of the bazillion thank you notes that we end up getting people all the time. Some pictures of some of the groups we've had through. We really have a lot of fun, and students really love coming up to the SEM Center. This is another one of our control rooms, and We can of course control everything from here. We use Beeline Sim Capture for our recording system, which is a cloud-based system located here. We do have servers that can store all of that, but it's stored in the server and then transferred to the cloud system from there. We just got new flooring in the center, so we're pretty proud of what that looks like. This is the second control room here. In the back part of that is where our servers are located at. Again, faculty can come in and view while we're doing simulations from these rooms. The nice thing about these two control rooms is that they are located directly behind the nurse's station, so we can view everything that's going on, all the action while it's happening, which is great. We can also record the nurse's station and listen in on what's going on through the microphones we have set up. We'll step out of the control room here and then start making our way towards the back part of the acute care wing of the center. There's the new flooring that I'm proud of. Finally, we had carpet that was here for about 7 years and it was looking pretty dingy by that point. These right here is our registration area. We have iPads that students can register on, as well as do their evaluations afterwards. So they will come here to that station to fill out their post-simulation evaluations. We use a Pyxis, of course, for medication administration. We do have lockers here that students can use. It's kind of like, you know, when you go to a swimming pool, they've got or like a water park or something, they have the wristband thing that they can take off and use while they're here. This is the back part of the center, and there are 2 additional sim rooms, a classroom, a debriefing room, and a control room back here. Walk back to the back part of the center. You'll see our storage area as well as our double robots. So these double robotics robots we use for education courses, variety of different disciplines. It's basically an iPad on a Segway. You might have seen these before, but this allows us who are living in California or Timbuktu to be able to be a part of a simulation here in the center, and they just wheel this around, using their own iPads, iPhones, or desktop computers. This is some of the storage closets we have. We hired procedural kits that we get from the hospital here. I'm going to show you the second drawer, which I'm not very proud of, but basically it's just we use it to store a lot of the stuff we use for Halloween and so forth, and then we have this big mess of simulators that we use basically for bodies when we do mass casualty exercises, because they're older pieces of equipment. This is some of the OT and physical therapy equipment that we have that we use quite a bit. OT and PT are one of our largest users. Athletic training also. All right, so we'll make our way. On the left here is one of our debriefing rooms. This room's a little bit different because we can use it for debriefing, or we can have students and then practice doing things. A simulator, which is located directly in the room here. We use this a lot for the PALS and ACLS classes, because you can be right there and then go walk right over and create code or things like that. We walk back out, and this is another one of our office spaces. This is the lead clinical simulations specialist office over here. As I mentioned, she also has one across the street in the Lansbaum Center. And both her and I are constantly going back and forth between the two areas. Doesn't really present a problem because we're back and forth so much anyway. These 2 rooms are simulation rooms. This is again, I think we probably use this most for our ACLS classes, these 2, because what's nice is the classroom's right next door, and they can go back and forth with these. This is our back control room. We use it some for control, but we also use that as kind of as the store some of the standardized patients equipment, as well as microwave and refrigerator for them. One thing we don't have, which I think still unfortunate, and a lot of great simulation centers have, is a nice area for standardized patients, a lounge area that they can, which unfortunately we don't have at this point. Another sim room. Again, this is one of our more used ACLS rooms. This is one of our classrooms. We do have additional classroom space in the building that can hold 50, 60, 70 people depending on the room. The room gets used a lot just because it's right here in the Sim Center. It holds about 30 people, but with COVID we're limiting it to 15 right now. We just did, right after this video, put in a brand new 70-inch monitor in this, so it's nicer space. We also just did RHIC boards for each of the rooms. Okay, so we're going to walk back through the center, and I'll take you out to the skills lab so you can see that. Again, you can see the registration area there in the middle. We're trying to use, and I think we do a really good job of using our space the has the capability of doing. This is one of our supply rooms. I wanted to show you in here so you can kind of see how we organize this. It is a small space, but we do with what we can with it. All of our equipment is provided mostly through the hospital as far as our supplies, our supplies, and these are all marked as for simulation only, or the piece of equipment is taken out of this room with a sticker. And this goes everything. We have, gloves and trach kits and central line kits and spirometers. These are some of our demo dose medications that we keep in here until we put them in the Pyxis. Some of this simulated swab sticks, Foley catheter kits. Pretty much all of our medical supplies are located in this room or in our skills lab. For the stickers that I said what we use. So before somebody takes something out of here, they pick up a sticker and they take it out. So we do have a small skills lab located here within the wing. This is used for a variety of students, disciplines. This actually can be accessed in the middle of the night by the hospital's family practice residency to practice, putting in a chest tube here before they have to go out and do it on the floor or something, or an IV or so forth. It's up, I think, for a Foley catheter insertion for some from, I think, St. Mary of the Woods College. Then we'll always have IV arms set up so students can come and practice that skill and suturing too. Just recently purchased and not yet installed brand new scrub sink. This was requested by our PA students and by the cert techs from Ivy Tech Community College. This here is just the storage area for a lot of the training supplies that we use that we don't have laid out for a specific class. We pretty much have every kind of procedural task trainer to think of, and then this just kind of gets also a variety of different things. Ultrasounds, the colonoscopy, bronchoscopy trainer that we don't want very much. Some robots. Some of our equipment that we take out on the road. And then finally we'll go here to the front right of the Sim Center acute care area, and this is the driving simulator room. So occupational therapy students from Indiana State University use this frequently, at least once a week, twice a week. They will practice skills with each other, students, and then they also bring down patients from the hospital's medical rehab unit to train them or practice or assess them for being able to drive after a stroke. And these patients actually come down here and then get evaluated by occupational therapists that are trained in the use of the driving simulator.